Okay, in other news, there's now a plan to transform the St. Vincent Charity Medical Center, which includes the end to inpatient care by mid-November. Officials said this transition will go from acute care hospital into an ambulatory health services provider. Primary care, internal medicine, and specialty clinics will stay, and the emergency department will now be urgent care only.
And tonight, there are new hardships being realized with that announcement that there are those changes coming to St. Vincent Charity Medical Center. One specific concern is for the people who depend on the Salvation Army for help, because the Salvation Army depends on St. Vincent.
Behavioral health and social services agencies in general are really struggling right now.
Bo Hill of the Salvation Army understands the struggle. The question tonight is, will it intensify? The Salvation Army is dependent on St. Vincent in part because it's just 4 blocks away on East 22nd Street in downtown Cleveland. It is a close, critical lifeline.
So when you're talking about the people that we are called to serve, proximity is key, and the opportunity for our people to get services, just a few blocks from us is very, very important.
Cleveland City Council President Blaine Griffin isn't holding back his feelings about the changes.
Disappointed and frustrated. This is the 9th hospital to shut down in this region since 1990. We got to have more of a commitment to the urban core. This is going to have a devastating impact on the surrounding neighborhood.
The statement put out by the City Council today was sharp, saying, "We're disappointed by this decision. However, as leaders, we will take every step to right this wrong." I asked Council President Griffin how they plan to do that.
I've talked to leaders of the SCIU, and we're going to work hard to make sure that we try to find places for those workers to go to. We've already reached out to university hospitals and Cleveland Clinic and Metro, because we want to make sure that these phlebotomists, these nurses, and others have a good opportunity to go and work in one of these healthcare institutions.
Back at the Salvation Army, Hill tells me there's a question mark as to what comes next for them.
As far as how we are going to interface with St. Vincent Charity, I think that we're going to have to see how things play out.
It's a blow to our community. So let me state this: the wrong is anytime that we have a major institution, an anchor institution in our community that leaves, it's not something that our community takes lightly.
What he's mentioning there about the wrong is, I asked him, because in their statement they're going to right the wrong. And I asked him, well, what is the wrong? And that's what he was referring to there. One of the things that really stuck with me with Bo Hill from the Salvation Army is he said, of course, they really just don't know how this is going to play out. So what he's doing right now is he's praying. And he's not just praying for them, he's praying for everybody at St. Vincent, because they have depended on them. They have worked in great partnership. And he understands just as well as anybody else does what the pandemic has done, and part of this reason is because of the pandemic and because of the shortages of staff, and it's a hard all the way around.
Well, to put this in further perspective, this hospital has been around since the Civil War, and if you look at the zip codes surrounding the hospital, they are the 2 highest zip codes with the lowest life expectancy in the city of Cleveland. So this is a big deal.
And they're helping so many people with mental health. And Lydia Sparrow, we mentioned that on the afternoon meeting as we're putting together our 11 p.m. She's focusing on that tonight, so stay with us for that. But it's a big issue, and I know, like we heard in your piece, Christi, a lot of people are hurting from it.
Big blow to the community.